You've probably heard the term RSV going around, especially in the colder months. But what exactly is RSV? And why is it especially dangerous for some people? Let's break it down in simple science-backed terms. RSV stands for Respiratory Syncytial Virus. It's a common virus that infects the lungs and breathing passages. Almost everyone gets RSV by the age of 2, but while most healthy people recover in a week or two, RSV can be serious for infants, older adults, and people with weakened immune systems. RSV spreads just like a flu or a cold, through droplets from coughs and sneezes, by touching a contaminated surface, or through close contact with an infected person. RSV mainly affects the lower respiratory tract, especially the bronchioles, which are tiny airways in the lungs. The virus causes these airways to become inflamed and filled with mucus, making harder to breathe. In severe cases, RSV can lead to bronchiolitis, which is inflammation of the small airways, pneumonia, infection of the lung tissue, and hospitalization, especially in babies and the elderly. For most people, RSV looks like a mild cold, but in vulnerable individuals, it can quickly worsen. Typical symptoms include runny nose, coughing, sneezing, fever, wheezing, trouble breathing, loss of appetite. In babies, RSV can be harder to spot. Watch for short, shallow, rapid breathing, unusual tiredness, or a bluish color around the lips or fingernails. This could be a sign of low oxygen. People at highest risk for severe RSV include infants, premature babies, children with chronic lung or heart disease, adults over age 65, and people with a weakened immune system. Each year in the US, RSV causes thousands of hospitalizations in children and older adults. It's not just a harmless cold. But doctors diagnose RSV with a nasal swab or by observing symptoms, especially during the season. There's no specific cure, but treatment focuses on supportive care, staying hydrated, controlling fever, using humidifiers, and in severe cases, oxygen therapy. There's now also preventative injection for high-risk infants and newly approved RSV vaccines for older adults. RSV is incredibly common and often mild, but it can turn serious, especially in baby and seniors. The best defense? Wash your hands, keep infants away from sick people, stay home if you're sick, and if your symptoms worsen, seek medical care early. The more we understand viruses like RSV, the better we can protect ourselves and our loved ones.